Hi, I'm Dr. Michelle Ross. I'm a neuroscientist and founder of Impact Network. We're a 501c3 nonprofit research institute located in Denver, Colorado, and we're focused on improving marijuana policy and accelerating cannabinoid therapeutics for women worldwide. Today, I'll be talking on autoimmune disorders and cannabis, not only as a researcher and cannabis health coach, but as a patient myself. So a little disclaimer before we start. I am not an MD or a medical doctor, so this is not medical advice. The facts in this presentation have not been evaluated by the FDA. So again, if you have a serious medical condition and you're interested in learning about cannabis, I implore you to talk about it with your doctor and let them know if you are using cannabis or CBD products. It's always important to be honest with your doctor. So what this talk will cover, first we're going to go into intro to the endocannabinoid system. Then we're going to cover how cannabis is used for multiple sclerosis or MS. Next, we're going to cover how cannabis is used for rheumatoid arthritis. Then we're going to go into how cannabis is used for lupus, another autoimmune disorder. Finally, we're going to talk about how cannabis is used for fibromyalgia and other autoimmune or autoimmune-like conditions, and talk a little bit about next steps and possible research directions for autoimmune disorders in cannabis. So first off, what is this endocannabinoid system? Well, it's the reason why cannabis has so much potential. You may have heard about medical marijuana in all of its possible uses, from cancer to depression to epilepsy, Alzheimer's, diabetes, so many different things that it could be used for. But that sounds crazy, right? How could one plant, how could one medicine be used for so many different applications? Well, I'm here to tell you as a neuroscientist that there's a simple answer. It's because you have an endocannabinoid system, and this system, your largest neurotransmitter system, regulates every other neurotransmitter system in your body and brain. Literally, the endocannabinoid system is the master controller, the key to balance in your emotional, spiritual, and mental health. So how does the endocannabinoid system work? Well, to make this easy, we'll talk about locks and keys. So you have these natural marijuana-like components called endocannabinoids. These include anandamide and 2-AG. These are your endocannabinoids that fit into receptors called cannabinoid receptors. So your endocannabinoid, like anandamide, is the key, and your CB1 or CB2 receptor is the lock. Once these two components match up, then that instigates a whole bunch of downstream signaling that results in things like improved mood or learning or attention or eating or fleeing or a whole bunch of things that control our body movements, thoughts, and other processes. So we have endocannabinoids like anandamide and 2-AG. But what are plant cannabinoids? Well, they're actually called phytocannabinoids, and phytocannabinoids come from plants like cannabis. The main cannabinoids in cannabis include THC and CBD. THC actually activates or unlocks that CB1 or CB2 receptor. The CB1 receptor is what's associated with pleasure, that feeling of high when you take cannabis or THC products. CBD or cannabidiol isn't exactly the same way. It doesn't bind really to CB1 or CB2 and activate them. What it does is actually naturally elevate your levels of endogenous or endocannabinoids like anandamide. So CBD actually boosts your natural levels, and then those endocannabinoids bind to CB1 and CB2. So if you compare THC to CBD, THC is a much stronger activator of the endocannabinoid system. It's almost like hitting a hammer on the endocannabinoid system, while your own natural endocannabinoids like anandamide or drugs or substances that boost your endogenous endocannabinoids like CBD are a much gentler activator of our natural endocannabinoid system. So you have endocannabinoid receptors both in your brain and body. And I'm going to talk a little bit about where these CB1 receptors are, the ones that are really responsive to THC and that high feeling in the brain. So CB1 or cannabinoid receptors are found all over the brain. They're found in your hippocampus, where they help you manage learning and memory and stress and mood. They're found in the spinal cord, where they regulate feelings of pain. They're found in the cerebellum, where they can help you regulate balance and movement. Same as the basal ganglia, which is another area that controls movement. And then you have cannabinoid receptors, CB1 receptors, in your cerebral cortex. And that's responsible for your higher executive functions, like impulse control and morality and compulsive activities, or planning, judgment, all the things that make us feel human happen in that area. So cannabinoid receptors are everywhere. They're such an important part of our body and our brain. What's really important when we think about cannabis as a potential medicine or as a potential alternative to painkillers like opiates is that cannabis cannot kill you. You cannot overdose on cannabis because there are not receptors for cannabis. There are no CB1 receptors in the brainstem. And that's really important because there are opiate receptors in the brainstem. And when opiates bind to those receptors in the brainstem, they slow down breathing and they can cause eventually overdose and death. Cannabis can't cause respiratory depression and overdose. So whereas every 19 minutes somebody dies from a prescription drug overdose, no one is dying from medical marijuana. And even Dr. Sanjay Gupta endorses the fact that medical marijuana can be a safer alternative to a lot of different prescription drugs that are on our market, especially for those with autoimmune disorders. So concerns about cannabis being a dangerous drug, a drug of abuse, a drug that we might have recognized that teenagers might have smoked and used, in their high school years, and how could that possibly be a beneficial drug for me, a chronically ill patient? Well, we have to realize that a lot of the data out there is flawed. And in fact, recent research shows that cannabis is the exit drug. So most people that use medical marijuana or marijuana even recreationally don't go on to use harder substances like heroin, like meth, like cocaine. In fact, the opposite happens. They actually reduce their alcohol and drug use. So cannabis is the exit drug, not the entrance drug. What are some side effects of cannabis use, whether you're using it medically or recreationally? Well, you might eat a little bit more. You might feel high. You might feel pleasure. Keep in mind that psychoactivity isn't just restricted to cannabis. A lot of different drugs on the market might make you feel high. These include Lyrica, which is used for fibromyalgia, or morphine, which is used as a painkiller. All these drugs, when you take them initially, make you feel high, or if you take too much of them at one time, or if you drink alcohol with them, they will make you feel high. Cannabis might make you feel sleepy. There's ways around that. You might be able to take cannabis before bed so that it enhances your sleep instead of keeping you up, instead of making you sleepy during the day. Cannabis might make you paranoid or anxious. There are ways around that too. You might add different cannabinoids or use cannabis in a different way so you don't feel anxious or paranoid. For some patients, THC is never a good thing, and we can refer them to CBD-only products. Impaired short-term memory is a side effect of using CBD. Caffeine combined with CBD can offset some of that short-term memory loss. And again, when we're looking at pain relief or inflammation relief in autoimmune disorders, this is a small side effect to deal with in terms of the benefits you're going to receive from cannabis. There is some abuse potential with cannabis, as there is any pharmaceutical product. However, withdrawal symptoms associated with cannabis and abuse potential is pretty mild in comparison with other drugs, especially opiates. So cannabis does have some abuse potential, as does any pharmaceutical drug. The withdrawal symptom and the likelihood of having cannabis use disorder is very, very low in comparison with other drugs, such as opiates, where the withdrawal symptom is quite severe and opiate abuse can lead to death. So cannabis is safer and has less side effects in general than most other pharmaceutical drugs. What's in cannabis that makes it so special and so medicinal? Well, there's over 400 chemicals in cannabis. We know that there's over 111 cannabinoids in cannabis, and these are those chemicals that can bind to cannabinoid receptors like the CB1 and CB2 receptor, or they can bind to other atypical cannabinoid receptors that have some very complicated names and abbreviations like GPR55 and TRPV1, and the list goes on. We don't even know all the receptors that cannabinoids bind to. We're learning new ones each and every day, and that is so exciting as a scientist and as a patient looking for new therapeutic potentials of cannabinoid products. Other cannabinoids that we talk about besides CBD and THC include CBC, CBG, a lot of these different combinations of CB. They stand for things like cannabigerol, or, and I'm gonna just space out there, sorry. So, so there are over 111 cannabinoids in cannabis, and a lot of them have unknown applications. A lot of them have very hard to pronounce terms, so they're abbreviated with CBG, CBN, CBD, CBC, THCV. Actually, that one's a cool one because it'll reduce appetite and it's really good for migraines. There's more applications for that one coming out every day. CBD and THC are really interesting in the fact that they have raw acidic versions of them, and these versions are called THCA and CBDA. And in fact, these cannabinoids are the kind that you find in the plant. The plant doesn't make THC, it doesn't make CBD, it makes THCA and it makes CBDA. It actually takes a chemical process called decarboxylation, or heating up THC or CBD or THCA to turn it into THC, or heating up CBDA to turn it into CBD. So the plant, again, makes these raw products, and these products have specific properties, especially when we're looking at autoimmune disorders, which I'll explain in a little bit. A final component of cannabinoids is terpenes, and these terpenes are responsible for giving cannabis its specific flavors and smells. Like strains like Super Lemon Haze, for example, might smell a little bit lemony, and it's because it's going to have a specific terpene that gives it that lemon smell and also has medicinal properties. So some of these terpenes include limonene, and that's that lemon smelling terpene, and it has benefits like anti-anxiety, antidepressant. That could be really helpful for someone with an autoimmune disorder that has a high amount of anxiety for living with a chronic illness. You also have terpenes that smell like black pepper, and this is beta-caryophyllene. That terpene is actually highly present in cannabis as well as other spices. It's found in black pepper, for example, and that terpene actually directly activates CB2 receptors, which are the ones that are found on immune cells, and help reduce pain and inflammation. So it's interesting, that is the only terpene known right now to actually directly activate cannabinoid receptors. None of the other ones activate cannabinoid receptors, although they have different targets, and we're also discovering that every day. Another terpene to identify that could be helpful for autoimmune disorders is linalool. Again, because it has a very good anti-anxiety profile, and as we know, any autoimmune disorder can be flared up by stress, and if you can remove stress, you can remove anxiety, you can greatly improve the quality of life for a patient. So how do you use cannabis or CBD when it has all these amazing chemicals and profiles that can work together to make you feel good or provide symptom relief? Well, I don't have my whole box of goodies here to show you, but the most common way people understand using cannabis is smoking it, right? You light up a joint or a bong or a pipe. This is not a great way to manage autoimmune disease or any chronic illness, because when you burn cannabis, you actually release ammonia and other toxins. And you don't really want to be breathing toxins in. You want to be getting as many toxins out of your system as possible, because that might actually underlie the root of your autoimmune disorder. So an alternative to smoking is vaping cannabis. And that method, you heat up the cannabis and you release the cannabinoids and you inhale them, but you don't produce any of the toxins like ammonia that might be harsh on your lungs or contribute to inflammation that is not good for your chronic illness. Another way that you can consume cannabis is by eating it or drinking it, and this is called edibles. So you can have brownies, you can have drinks, you can mince, you can make cannabis butter or canna butter and mix it into your meals, infused meals, for example. For patients with autoimmune disorders, I definitely suggest that you try to steer away from the fatty or sugar-filled edibles. You want to go for healthy ones like gluten-free edibles, infused pumpkin seeds, nuts, granolas, things like that, because sugar will cause more inflammation and make you sicker in the long run, even though it has cannabis in it. Another way that you can consume cannabis is with tinctures or sprays. These are things that you either spray in your mouth or you drop in your mouth, and it's absorbed under the tongue or through the side of the cheek, so sublingual or subbuccal. What's cool about that method is, unlike edibles, which it might take an hour or two to kick in, and it may be stronger depending on what other fatty foods you ate that day, so you don't have a consistent experience. When you take something sublingually or subbucally, you are going to actually bypass the liver. You're going to get that straight in your bloodstream, and those cannabinoids might be working within 10-15 minutes, maybe even faster depending on the formulations. So if you need instant pain relief, don't eat an edible. It's going to take too long for that to kick in. You want to take a drop. Another way that you can control pain and inflammation that's associated with autoimmune disorders is by taking oils. And this is either whether it's CBD or cannabis oil that's extracted and present in olive oil, coconut oil, grapeseed oils. There's also things like Rick Simpson oil or fecal oil. These terms are about how the cannabis is extracted and what the carrier oil is present in. There's benefits for using different types versus other types. But that can be something that we can go into further, especially when you talk one-on-one with, say, a cannabis consultant. We're not going to be going into how these different methods are extracted for the purposes of this talk. Another way you can use cannabis is with pills. These pills could just be the oils that I talked to you about. Instead of taking them under the tongue or swallowing them, you can put them in capsules and swallow them. You can also take tablets of, say, THC or THCA or CBD and THC in different ratios. A lot of these pills look a lot like pharmaceuticals that you might be familiar with. So it looks like you're taking a Tylenol, but instead it's a THC and CBD pill. That can be really comforting if you're not used to cannabis or green flowers or oils and things like that. If you're used to pills, there are definitely cannabinoid products that look more like pills for you or your loved one. Another form of cannabis that is amazing for autoimmune disorders is topicals. Autoimmune disorders can be characterized by a lot of joint pain, muscle aches, things like that. And so if you want to be able to manage these pains locally as they pop up, you can put a CBD or THC infused cream on there, and it might stop the pain, it might stop the spasms, stop rashes, and provide relief without the possibility of getting high from THC getting into your system. So it's nice for people that don't want to consume THC or can't legally consume THC, but still want to have symptom relief. Another way to consume cannabis is using patches. And so that's long-term relief, which is really great when you have a chronic illness that is not going away any day soon. If you're always at, say, a level 8 or 9 in pain, no matter what you do on every single day, a patch is probably going to be a good way for you to consume cannabis, because it's going to deliver the same amount of drug over a long amount of time, whether it's 12 hours, 24 hours, and it's going to provide that symptom relief, so your baseline is much lower in terms of pain and inflammation than it would be without that patch. Another way, and the last way I'll talk about using cannabis, is through suppositories. So for some autoimmune disorders, if you have very severe symptoms or you have more than one autoimmune disorder, you might want to use a rectal or vaginal suppository. Again, that's only if you really need a high dosage of cannabinoids and you want to bypass the liver due to some issues, whether it's you want to avoid the psychoactivity of THC or you have a specific pain set, whether it's Crohn's disease or something where you're trying to target the GI tract as opposed to just generally trying to get your cannabinoids throughout your body. So suppositories are great for reducing high as well as getting targeted cannabinoids to your lower abdominal region. So how is cannabis used for different autoimmune disorders? We're going to start off with one of the most well-known ones, which is multiple sclerosis, or MS. So MS is actually one of the most studied conditions in terms of how cannabis is used. So what is MS? So MS is an autoimmune disorder and is characterized by damage to the nervous system, including your brain, spinal cord, and optic nerve. You end up with vision problems, fatigue, pain, walking issues, balance issues. It's not a fatal disease, but it's definitely a neurodegenerative disease that's progressive over time. Some patients can walk with assistance with canes. Other ones end up so disabled that they're in wheelchairs. We do know that there are about 2.3 million patients worldwide, and that MS is more common in women than men. One of the most famous advocates right now for MS and cannabis use is Montel Williams, a former talk show host that has MS and now advocates across the country for it. So it's nice to see that people are being more educated about this condition. Some of the ways that cannabis can help MS is by reducing the pain and inflammation associated with the condition. CBD itself can actually be neuroprotective, and it's suggested that if a patient takes it right when they're diagnosed, that they may actually be able to halt progression and damage of some things such as the optic nerve. Of course, more research needs to go into this, and there's still some debate over what's more helpful for MS patients, CBD versus THC, or a combination of CBD and THC. We do know that THC is helpful for reducing spasms associated with MS. There's also improvement with mood and sleep in differing ratios of CBD and THC. Most of the clinical research that has been done on MS has actually been done by Jdjdj Pharma, which has produced a 1-to-1 THC to CBD spray called Jdjdj. In our country, a lot of research has not been done yet on products that are available either on the recreational or adult use market. However, in Colorado at CSU Fort Collins, Dr. Thorsten Rudroff has actually completed a study and published on cannabis and MS patients and found that it did improve their quality of life and did improve their mobility, and has called for further research supporting legal products in the US for MS patients and access for MS patients across the United States. It's not fair, again, that one state has access to MS when it has been more studied than several pharmaceutical drugs that are already on the market. So cannabis can also be used for rheumatoid arthritis, another autoimmune disorder. This autoimmune disorder impacts over 1.5 million patients in the US. Most of them are older, between age 40 and 60, and many patients with rheumatoid arthritis also have other autoimmune disorders. So one autoimmune disorder often collects other ones. They're very friendly. So autoimmune disorders with rheumatoid arthritis are characterized by tender, warm, swollen joints, joint stiffness, fatigue, fever, pain, weight loss, and several other undesirable symptoms that really cause disability. Imagine if you can't use your hands, you're not going to be able to help around the house, you're not going to be able to work, and you're going to be have a pretty depressed mood. So cannabis can help reduce the pain and inflammation, and especially when we're not even talking just about CBD or THC. THCA, that raw form of THC is very valuable for rheumatoid arthritis. Whether you're using it as a cream or you're eating it, for some patients that have had no relief with THC and CBD, turns out that THCA is very helpful for reducing their inflammation. So it's another nice tool to put in the toolbox, especially when we don't hear too much about THCA. So CBD, THC, THCA can help improve anxiety and depression linked to chronic pain. THC and THCA can also increase appetite, which is important if you're suffering from weight loss, and not every patient with rheumatoid arthritis suffers from weight loss. We can reduce total disability, which again is amazing when you can get people off of disability, or at least back into doing some of the things that they used to love to do, including taking care of their kids or their grandkids. Topical administration is really helpful for patients that can't use THC for some reason, whether they get drug tested or they have some kind of other opposition to it. So topical administration of THC or CBD can be very helpful in reducing the joint pain, muscle pain, stiffness associated with rheumatoid arthritis. So I want to touch on those raw cannabinoids. THCA and CBDA are very, very amazing tools for patients with autoimmune disorders. They're more bioavailable than THC or CBD, which means that your body's actually using more of them. They activate different receptors besides CB1 and CB2. They actually activate receptors that regulate the endocannabinoid system. So just to make things more complicated, right? Because that's what I do as a scientist. The endocannabinoid system regulates every other neurotransmitter, but then there's another subsystem that regulates the endocannabinoid system. So we went from, here's our broad, flipping the radio stations, dial, to the endocannabinoid system is your fine dial, and then we have like the super fine dial, which is these raw cannabinoids. So possibly ingesting raw cannabinoids may help balance your endocannabinoid system if it's out of balance, which then can help balance all the other neurotransmitters. So we have a very complex system here, but it's super easy. The plant has given us some raw cannabinoids, which are very useful for us if we consume them. They're very anti-inflammatory. They're more anti-nausea vomiting than either THC or CBD. So we're going to find out if they have even better potential in autoimmune disorders in the future when more research is done. So how is cannabis used for lupus? And I want to pause on this because I founded my nonprofit based on the fact that I had a family member in New Jersey that had lupus, and she wasn't really convinced that cannabis was helpful for her disease. I mean, how could she be convinced? Her doctors didn't tell her about it. She had been on every pharmaceutical, in existence, gone through so many medical treatments, and if it was a real medicine, her doctor would have told her. Of course, New Jersey didn't have a very strong medical program, or any at the time. So it was one of the things that really inspired me to do more research on cannabis for autoimmune disorders. So lupus is an autoimmune disorder that can be characterized by pain and rashes, fatigue, swelling of your hands and feet, blood clotting, weight loss, anemia, seizures, mood disorders. Sometimes your hands and limbs get so bad that you actually have to have parts of them removed. Is a really, really nasty disease, and it's made worse by the fact that the pharmaceuticals that treat lupus are even worse sometimes. They have worse side effects than the symptoms of the disease. So here we have people that have been damaged for years by taking these anti-lupus drugs, and sometimes they develop secondary disorders from the drug effects themselves. There are 2 million patients in the US with lupus, and most of them are women and young women, primarily ages 15 through 45. One way that cannabis can help lupus is that we are targeting the CB2 receptors that are on the immune cells. So we have a direct connection to why cannabis might help. We also know that things like THCA work. We have a lot of anecdotal evidence across the United States, especially in places where people, for some reason, feel morally opposed to the psychoactive high from THC, that THCA is helping them with their lupus symptoms, even better than some of their prescription medications. So how might this happen? We're reducing that pain and inflammation, we're improving mood, and we're reducing nausea and vomiting, which again, when people can eat, they get more nutrients in their body, and that helps their immune system be able to function properly. If you can't even absorb normal nutrients, your body is so tapped out that you're not going to be able to have an improved quality of life, even when you're on other pharmaceutical drugs. So how is cannabis used for fibromyalgia? First off, I want to say that fibromyalgia isn't actually classified as an autoimmune disorder, but is an autoimmune-like disorder. In fact, a lot of people with true autoimmune disorders like lupus or rheumatoid arthritis are often also diagnosed with fibromyalgia or vice versa. So autoimmune disorders seem to cluster. Once one domino falls, another domino falls. I'm really passionate about cannabis for fibromyalgia because I suffer from fibromyalgia. And in fact, after being on medication after medication that just made me sicker and sicker, cannabis is the only thing I'm on. I use multiple forms of cannabis for my fibromyalgia, and my quality of life is so much better than it was on prescription drugs. So I'll share a little bit about this disorder and how cannabis can help. So fibromyalgia impacts anywhere between 5 to 10 million patients in the US. Numbers aren't really clear, partly because diagnosis of fibromyalgia takes so long. And sometimes people are misdiagnosed, or they're diagnosed with another autoimmune disorder. For example, you might be diagnosed with lupus when you actually have fibromyalgia. A lot of doctors aren't educated about this disorder. So when you have issues with who has it, it's really hard to track who's benefiting from cannabis for this disease. But what is fibromyalgia? So it's an autoimmune-like disorder that's characterized by widespread musculoskeletal pain. So that means you have pain in your bones, you have pain in your muscle, you have pain in your joints, you have pain in specific places where somebody poked me right here. That shouldn't hurt somebody, but with someone with fibromyalgia, they actually have tender points throughout their body. And that is one of the ways that you can actually diagnose this disease, because they'll be there no matter what for no reason. It's like being bruised and with no bruises. You're like, why does this hurt? Well, it's your disease. So symptoms of fibromyalgia include, and I just went and said the same thing over again. So you can see a symptom of fibromyalgia is called fibrofog. So that's a cognitive issue where you forget, you lose your place, you lose things, even if you're a very intelligent person with a PhD. So how does somebody get fibromyalgia? It just doesn't appear out of nowhere. Right now, we don't think that there's any genetic causes for it, but some people develop it after an emotional or physical trauma, like a car accident or surgery, or exposure to environmental toxins like black mold or lead, or some other really significant life effect. This happens to women usually, and it appears in their 30s, although because of the long diagnosis time, it can take many, many years for somebody to actually be diagnosed. Cannabis helps people with fibromyalgia. In fact, there's been clinical research that suggests that the current fibromyalgia treatments and pharmaceuticals like Lyrica that have been recently approved are not effective for most patients, and in fact have a whole bunch of adverse side effects, like weight gain, like significant weight gain. I know this because I've also gone through these treatments after being on antidepressants and anti-seizure medications and painkillers, and being dependent on painkillers for my condition and really not receiving any significant relief and actually being reduced to disability. I was not alone. Like, what I found out is that a lot of people with fibromyalgia were lost. They were just dumped a whole bunch of pharmaceuticals on. Here, take all of them. You know, one of these has got to work. Oh, none of them work. Well, keep taking them all. And it's a hard story. What happens with fibromyalgia patients is that because these pharmaceuticals don't work and their doctors don't really care that they don't work, most of these patients end up so disabled by pain and other mental health issues that they end up dropping out of the workforce, out of the social circles. So they become disabled and withdrawn. So about 30% of patients with fibromyalgia are in fact disabled and unemployed for the most part. So this is unfortunately a disease that does not have a good outcome. But here we go and we introduce cannabis. Cannabis has provided hope for a lot of patients because, again, they have exhausted all resources and nothing is helping them. Cannabis actually improves fibromyalgia symptoms in a recent survey of over 90% of patients that use it. This sounds really optimistic, but in fact, I have not met any fibromyalgia patients that did not find even a small percentage of increased quality of life or symptom reduction. And in fact, the ones that don't see significant symptom reduction, it's because they don't know how to use it. They don't know anyone else with fibromyalgia, or they haven't talked to a doctor that tells them how to properly use cannabis, or what strains to use, or that there are topicals, or that there are, you can use an edible, or you can vape a product. So it's all about this application of the product, not so much that, sorry, I tried cannabis once and it didn't work for me. If you are using it properly, it will help with fibromyalgia, at least some of your symptoms, maybe not all of them, but it should help some of them. Let's see. So one thing I do want to point out is that fibromyalgia is connected with serotonin deficiency. And because we are looking at an endocannabinoid system that regulates different neurotransmitters like serotonin, it's possible that the endocannabinoid system may really go at the root cause of fibromyalgia, which again is a complex disorder with pain, with skin issues, with joint issues, muscle issues, so many different complex groups that really rebalancing these levels of neurotransmitters is so much more effective than trying to treat each one of these symptoms with a different pharmaceutical drug. Let's get to the root of the problem instead of masking all the symptoms or providing palliative care. So we don't know all the answers to cannabis and autoimmune disorders. Heck, we have so much to learn. There's almost no clinical and basic research on this, despite anecdotal evidence. And this isn't really cannabis industry's fault or the federal government's fault. The federal government really doesn't provide a lot of funding for autoimmune disorder research in general, so it's not surprising that there's not any funding for autoimmune disorder and cannabis research. We do need cannabis brands and pharmaceutical companies to develop condition-specific products and explore things like raw cannabinoids and the synergies between some of these unexplored rare cannabinoids for the purposes of autoimmune disorders. We need to do research on some of the autoimmune disorders I didn't highlight today because there are so many different disorders. Some of them are rare, some of them are fortunately escalating in incidence like Lyme disease. Doctors need to be educated on cannabis for autoimmune disorders. Very few doctors will touch it. They don't know anything. They weren't educated in medical school or nursing school on cannabis, and definitely not on cannabis for autoimmune disorders. Finally, disease nonprofits such as the Fibromyalgia Association or Rheumatoid Arthritis Foundation, they need to educate their members about the benefits of cannabis for their condition. And if they don't know, they need to reach out to those who do know, because it's not right when a patient has an option left out on the table that they could have been informed on from day one. If they knew that they could use cannabis as a pain reliever instead of an addictive and possibly deadly opiate, a patient might make a different decision on day one instead of finding out about it when it's too late, when they are addicted to opiates or they have dropped out of the workforce or some other issue. So we really need to get this information to the patients that need it from day one, not as cannabis as the treatment of last resort. So with that, I want to end on the fact that cannabinoid medicine is personalized medicine. There's not a treatment plan that will work for patient A, B, C, and D, all with the same condition. Each of us are different. Some of us are going to respond to different doses. Some of us are going to need different routes of administration based on our lifestyle and our diet and our genetic background. No strain product is going to work because we're all so different. And just like antidepressants, there's going to be a lot of trial and error with cannabis products for autoimmune disorders. It's a tricky new field, and I want to say, explore it, understand it, ask questions, ask your doctor, attend educational events, tell your friends, but have patience, and when you're trying it yourself, keep a diary, keep a log, because you're going to know the best whether cannabis or a specific cannabis product is helping you. And I'm sure it will, but you have to put the investment and the time into it to make sure that you're doing the best thing for your body, your brain, and your soul. So thank you so much for listening to Cannabis for Autoimmune Disorders. I'm Dr. Michelle Ross from Impact Network, and I hope that you tell a friend and share this information. Thank you.